Multiple sclerosis is believed to be an autoimmune condition in which the immune system is excessively active and attacks the nervous system. The central nervous system is the part of the nervous system involved in multiple sclerosis. The central nervous system includes the brain and the spinal cord. The nerves in the central nervous system communicate with each other through long, wire-like processes that have a central fibre surrounded by myelin. In multiple sclerosis, the immune system cells produce inflammation that injures the myelin. In addition, damage occurs to the axon. This process occurs in age-related neurologic diseases such as Alzheimer's and Parkinson's disease also. The symptoms of MS are highly varied, but frequently include pain, muscle spasticity, fatigue, inflammation, and depression. These are symptoms that can be directly targeted using alternative medicine. CBD, for example, cannabidiol. Supplementing with this may be advisable for MS to reduce the fatigue, the pain, the spasticity, and ultimately improve the mobility. Capsaicin, which is derived from hot chilies. It may be useful for some people in relieving pain. It's also been shown to help reduce urinary incontinence by reducing spasms. It also helped to double peak bladder capacity, which could be useful for someone experiencing urinary incontinence due to MS. Ginger has also been shown to help with pain relief and is a powerful anti-inflammatory. Valerian has an anti-spasticity effect. Chamomile also has numerous benefits, one of which is believed to be its anti-spasticity effect in MS, and it's also a powerful anti-inflammatory. Panax ginseng was shown to help with the fatigue that's associated with MS. Salvia officinalis, which is sage, was also shown to improve cognition in people suffering from MS. Curcumin, derived from turmeric, has anti-inflammatory properties, and it's been shown to benefit MS patients. Oregano also has anti-inflammatory properties and also antifungal properties. Therefore, it might be beneficial to MS and its related conditions such as candida overgrowth. There appears to be an association between multiple sclerosis and candida. As a result, controlling candida may improve some symptoms of the patient, such as fatigue associated with MS. Be sure to check out my other video on candida for other herbal treatments and dietary changes. Depression. St. John's wort has an antidepressant effect on patients with MS, and it can also help with neuropathic pain. However, it can also cause drug interactions with some conventional medicines used for treating MS, so caution is needed. The herb saffron has antidepressant effects while also delaying the onset of autoimmune encephalomyelitis, so this may be helpful also. Myelination. Just like insulation on an electrical wire, the myelin sheath is necessary. B12 deficiency symptoms can mimic the symptoms of MS. B12 is required for the production of the myelin sheath, and a deficiency can lead to improper myelination. Therefore, B12 might be helpful to a patient experiencing MS. Be aware that a B12 blood test is not reliable, as now food that's fortified with folate can give a false B12 reading and hide a deficiency. The best form of B12 is the injectable kind, or else for oral, it's sublingual methylcobalamin. Scientists have discovered that vitamin C promotes the repair of the myelin sheaths surrounding neurons, making it a potential treatment for multiple sclerosis. The best orally available form of vitamin C is liposomal vitamin C. After that, a non-acidic form would be recommended, with the least useful form being ascorbic acid. Vitamin C is also enhanced by taking bioflavonoids. MS and the immune system. Because vitamin D becomes active with sunlight exposure, those who live farther from the equator may have lower levels of vitamin D and higher risk of developing MS. A 25-hydroxy vitamin D blood test can assess your levels, and then you can supplement if necessary. Vitamin K2 was also shown to be depleted in patients with multiple sclerosis. Vitamin K2 works synergistically with vitamin D. Therefore, supplementation of K2 and D mix may be very beneficial for the patient. Therapies for symptoms, including medication-based and non-medication approaches, such as physical therapy, occupational therapy, speech therapy, and psychotherapy, are all helpful for MS. Common MS symptoms that are treated using these therapies can include fatigue, depression, weakness, incoordination, walking difficulties, stiffness, and bowel and bladder disorders. Gluten sensitivity was observed in patients who were suffering from multiple sclerosis. Intake of fruits, vegetables, and legumes, whole grains, added sugars, and red processed meat consumption in patients with MS was assessed, and it was determined that patients who consumed more fruit, vegetables, and whole grains had less symptoms of pain and depression than those who consumed high levels of sugar and processed meats. Since antioxidant vitamins like A, C, and E lessen cell damage by free radicals, some researchers believe they may also be helpful in MS. Vitamin B1, or thiamine, is one of the most relevant vitamins in obtaining energy for the nervous system. Thiamine deficiency, or lack of activity, causes neurological manifestations, especially symptoms of depression, intrinsic to MS and related to its pathogenesis. Deer antler velvet. A conventional use of deer antler velvet in New Zealand and Australia has been to ameliorate the pain and the inflammation of arthritis, joint pain, back problems, and muscle fatigue or weakness. It's regularly used for post-operative recovery of patients in Russia. It's been scientifically proven to provide benefits such as improving the immune system's functioning, improving athletic performance and strength, improving muscle recovery after exercise, controlling blood pressure, and increasing hemoglobin in the blood. It's an excellent natural supplement for women's health. It provides vitality and anti-aging properties for seniors. It's an alternative natural supplement for bodybuilding and weight training. It's a superior source of growth factors. It can enhance sexual function for both men and women. And it's a natural supplement for arthritis and gout. What's needed is whole powdered deer antler and not one of the deer antler IGF extract sprays. I've personally seen miraculous results in a patient with polymyalgia rheumatica from taking large doses of deer antler velvet. Colostrum contains growth factors that can help to slow the aging process in anybody who takes it. It also helps to stimulate wound healing, cartilage, and nerve regeneration, which is all helpful in cases of multiple sclerosis, Guillain-Barré syndrome, and its variants. Grapeseed extract is one of the most powerful antioxidants ever discovered. It has numerous health benefits that dramatically extend your lifespan and improve your quality of life, such as strengthening and repairing connective tissue, helping patients with MS, helping teeth and gums, reducing allergic responses by minimizing histamine production, enhanced capillary strength and vascular function, reducing blood pressure and cholesterol levels, helping to prevent cancer, strengthening the immune system, increasing peripheral circulation, improving vision, and reducing skin aging and loss of elasticity. CoQ10 supplementation at 500 milligrams per day can improve depression and fatigue in MS patients. The antioxidant and anti-inflammatory activity may be considered as one of the main factors responsible for the anti-fatigue and anti-depression effects of CoQ10. CoQ10 is also enhanced when combined with 40 milligrams of PQQ per day. Omega-3 fatty acids contain two compounds, EPA and DHA, which are believed to decrease certain inflammatory responses in the body. This is why omega-3 supplements are often prescribed in conjunction with rheumatoid arthritis therapy. Since MS is an inflammatory disorder which causes progressive damage to the central nervous system, scientists have long explored the hypothesis that omega-3 fatty acids may somehow impede the progression and slow the severity of the disease. Doses for omega-3 range from 3 to 9 grams per day of an EPA-DHA omega fish oil blend. Be sure to watch my other video, the mitochondria boosters, as these can be helpful here, just like the CoQ10 and the PQQ. And check out my video on the related condition of Alzheimer's disease. And finally, check out my video on CBD for information about dosing and its benefits to blood flow in the brain.